Thank you for calling in today.
It's recording.
Hey everyone, this is Amanda. Hey Amanda, I was just saying we're just going to get started in a couple minutes. Thanks so much. Great, thank you.
I see that Jan is on, so I'm gonna. Thank you.
Sure.
I'm gonna make her presenter.
Okay, good.
Just make sure it's the right person. Thanks for the heads up on that one.
Sure.
For those of you who just joined, we will be getting started in about 2 minutes or so. So thank you.
And you had told her in advance that you were going to do that.
Mm-hmm. And I sent the controls on the bottom left. That's a message me if she has any questions. So, Jamie's asking if you feel like the audio is enabled.
So we will get started
So
momentarily.
it's
Thanks
now,
everyone for
right?
calling in today.
You have to call
Hi, it's Chris from AHA.
Hey Chris, it's Keisha. We'll get started in a moment.
Hi, Keisha.
Long time no talk. Alright, so we'll get started in another minute or so. Alright, so let's go ahead and just get started. So good afternoon, everyone. This is Keisha Pollock. Thank you so much for making time today to be on our PAPRN Plus monthly network call. We're going to start with roll call. I hope that most or all of you are online at Adobe Connect. If you are, we can see your name here. And for those of you who are not and you're just calling in, can you just please tell us who you are? That way we can keep track of everybody calling in today.
This is Laura Woodslow with the American Heart Association. I'm in the process of connecting, just haven't done it yet.
Okay, no worries. Thank you, Laura.
Hi, this is Teresa Tenbrook with NC State Screenplay and GP Red, and my computer is in the middle of an update, so I have to do it by phone.
No worries. Thanks, Teresa.
This is Hannah Thompson from UC Berkeley.
Great. Hi, Hannah. Thanks for joining.
Thanks.
Hi, it's Holly Russell from the University of Rochester. I'm also having some computer issues, but trying to connect.
Hey, thanks, Holly, for calling in.
Hi, this is Arlie Adkins and Maya Ingram at University of Arizona, and we were having some trouble with the computer login as well.
Oh, okay. Hopefully it's not an Adobe Connect issue, but if it is, hopefully that is resolved soon. I want to thank everybody for their patience. We've been trying different platforms, so hopefully, Arlie, that'll get resolved soon.
This is Stephanie Lemon from UMass, and I'm on Adobe Connect. Okay.
Awesome. Thanks, Stephanie.
This is Jana Hirsch. I think I'm connected in like 4 different ways.
Okay. Yeah, Jenny, your name is here, so you are all good when it's time for your presentation. So thanks. Great. Anybody else on the phone who's not online as well? So we don't see your name?
Yes, this is Semra at UNH. Sorry.
Oh, I'm sorry. Who's that from UNH?
Semra, ITOR.
Oh, hi. How are you?
Good. And Pam Edson from the National Physical Activity Society, and I'm trying to get in. Thanks.
Okay, great. Thank you. All right. Okay, is there anybody else on the phone who's not online so we can just know who's with us today before we get started? Great. Well, thank you again. And as a reminder, we are on Adobe Connect, and if you're able to hop online, please click on the web link that was sent out earlier today as a reminder, and also in prior emails announcing this call. wanted to just begin like we normally do with a moment for representatives from the CDC to provide some updates if there are any. I don't know, Tom, are you on the call?
I just did get on the call. I lost the call-in number, so I'm here, but don't really have updates other than to remind people that there is a Surgeon General's call to action coming out in about 2 weeks, and then of course there's this walking summit that will be following that with some very good workshops, including one by Keisha.
Great, thanks, Tom. I'll remind people about that too during the open mic at the end. And thanks for the reminder that the Surgeon General's call for walk-ins come out in 2 weeks. That's really exciting. Okay, great. So thank you, Tom, for that. And so I wanted to turn it over to Amanda to do our working group updates, or I'm not sure if you're going to be doing those or if the co-leads are going to do it, but I'll turn it over to you right now.
Sure. Hi, everyone. For just this week, I will be giving just one more update as we're still getting things off the ground. We just actually had a call with the Parks and Recreation Working Group leaders, and we are currently having calls, as I said, with all of the leaders of the working groups to plan out our first full call, so with all of the people that have signed up. And so the one main thing that I wanted to say today is just I'm going to be sending out the polls for everyone's availability either today or tomorrow. So if you have not already filled out the survey, and Eric, please make note, we'll include this in our follow-up notes, to please indicate your interest in a working group, or you won't receive the poll to include your availability for the call. So one more plea to fill those out if you have not already, and we'll send around the list one more time as well, so you can see if your name is listed where it should be. And so once again, we're really just working with the leaders right now to develop the agenda for the first call, and already have started talking about some of the research gaps in the different settings that we're working in. And again, those are complete streets, parks and recreation, older adults, workplaces, and rural settings. And we are very much looking forward to getting everyone in the network involved. And in the future, we'll be having updates on this call just about what the different working groups, the different projects that the working groups are collaborating on. So any questions at this stage for me?
Hey, Amanda, this is Keisha. Somebody had a question for me about thoughts on people being in multiple work groups, and what have you found so far? Is that happening, or is there going to be also an effort to promote some synergies between the work groups?
Yep, sure, I can address that. So right now, just looking at the list, there's definitely a lot of overlap in the people who have signed up for the working group. So, and that's absolutely fine. I imagine that people will identify which working groups fit best with what they're working on, and will possibly, identify one working group that they want to be more involved in, or, they may drop out of another working group or whatever. So that's absolutely fine. We understand that people will be potentially joining working groups at the beginning just to get a better sense of the projects that will be people will be working on, so to see if they're a good fit for that group or not. So that's kind of where that stands. And as far as identifying synergies, I will be, or me or someone from the coordinating center will be on all of the working group calls. And so we will, kind of listen with the ear to see if there are any crossovers that, the different working groups could collaborate on together. So we'll be kind of playing that role so that people don't necessarily have to be in multiple working groups to help identify those crossover areas.
Great, thank you, Amanda. Are there other questions for Amanda on the working groups? All right. Well, thank you, Amanda, for that update. And if individuals are interested in connecting with the working groups and have yet to do so, please look out for communications about that, or feel free to follow up with myself or Amanda directly, and we will connect you accordingly. So thank you. I am just looking again at the agenda, and our next agenda item is our research in progress. As a reminder, we started these a few months ago, where you can sign up to present some research topics or ideas or methods that you'd like some input on. And we are thrilled that our presenter today is Dr. Jana Hirsch. And after Jana's presentation, there will be time for Q&A. So I want to encourage you to jot down your questions for Jana as we go along. And I'll just introduce her and read her bio, and we can all see her face on the screen if you're looking at the computer. So Jana is a postdoctoral fellow at the Carolina Population Center at the University of North Carolina at Chapel Hill, and a visiting postdoctoral fellow at the Center for Hip Health and Mobility in Vancouver, British Columbia. She has a PhD from the University of Michigan, where she was trained in social epi, and a bachelor's and master's from the University of Pennsylvania. Her work focuses on the built environment and health, including spatial patterns over time, longitudinal methods, quantified self and health disparities. And she's also co-chair of the Older Adult Working Group. So we're thrilled to have Jana present today. And I think Eric is going to turn the presentation over to you if he hasn't already. And Jana, take it away.
Can anyone hear me? Ooh. Ooh. Oh. Turn that off. Okay. Now it shouldn't have any reverb.
Oh, you sound great. Thank you.
Okay. Perfect. Let's see if I can get access. Okay. So today I'm going to be talking to you guys about using a novel data source for physical activity research, and then hopefully getting some input about and brainstorming some ideas with you guys about ways that we could use this type of data for policy evaluations. So first, a little bit about the broader movement of quantified self. So quantified self incorporates technology into acquiring data about yourself on all aspects of your daily life. So this could be your diet, using things like MyFitnessPal, your physical activity levels, using MapMyFitness, which is what I'm going to talk to you about today, sleep patterns, and all sorts of environmental features. There are little trackers that go on your lapel that see how much sunlight you get. There are stress trackers, there's physical activity trackers, there's all sorts of trackers. It's a huge movement, and estimates say that there's over $200 million worth of digital fitness device sales in 2013. And the amazing thing about these tools is that they could really become a very powerful approach for collecting, tracking, and analyzing data nationwide. So for surveillance purposes, and also for pre-post policies. So you're constantly getting new data from people. And, oh, sorry, I just got a message from Amanda? No. So our current methods of surveillance for large geographic areas often are infrequent, or they are not getting at the same level of detail. And so this actually could be a way that we could begin to get data at a wide scale that's still very detailed. So some basics about MapMyFitness, which is what I'm going to talk to you about today. MapMyFitness is a suite of tools that users can track and map their physical activity workouts and the routes that they take for those physical activity workouts. So most people know this as Map My Run, Map My Ride, Map My Walk, Map My Hike, and I think there's maybe one other one now. This is just a very short timeline of MapMyFitness. So this is a pretty new development. They're one of the largest fitness tracking apps. So you can see that the first version of MapMyFitness was created in 2005. It was launched in 2007. But by 2012, they had already reached 11 million members. And as of the last estimate I can find, which is from 2014, they have over 30 million members worldwide. And these 30 million members use MapMyFitness to track their workouts. They can track them for walks or runs, bike rides. Basically, they have an app on their phone. They maybe wear it on their arm. They go outside, they press start, they go on the run, and it tracks them. And then when they're done running, they press stop, and it records that whole GPS route. It includes how far they've gone, how long it took, their average pace. If they have a heart rate monitor, it usually has that. It also includes the actual map. There are two different interfaces, one that's on the mobile app, like I just described, and then there's also an online interface. 97% of the routes in the MapMyFitness data set are recorded via GPS and the mobile app. And then once you have these routes, you can either, you can save them and share them with others who then can see that you've run this route, or can you choose to run that route themselves. It's an open platform that integrates with over 400 fitness tracking devices in the app marketplace. Here's an example just of the online interface. So it's a little clumsier than the app, and you can actually use it, and you would just click on the map that shows. And so this isn't exactly the type of data that we want, because maybe you just planned a route but you didn't actually run it. So it's good that 97% of routes are tracked using the app. As I said, they have more than 30 million users. This map comes from when they celebrated having 20 million users in 2013. And so you can see on this map, this is the starting point of all of the routes, and we have quite extensive coverage across the world, with especially large coverage in the United States, southern parts of Canada, and then Europe. 74% of users and routes when there were 20 million users were from the United States. So there's quite good coverage in the US. So the data comes in a few different ways. The routes themselves come as KML files. And so that would be the actual route that you chose to run when you were on that workout. The workouts then come with all the information. So it's the time of day that someone was working out, how fast it took them, or how long it took them to do that workout, or any other information that they input. And the workouts have a column that indicates the route ID so that you can link them to the geographic data. And similarly, the workouts have a user ID that allows you to link with the user data. The user data that I have historically received from MapMyFitness is age group, gender, and BMI. And the total database in 2013 was very, very large, with many, many, many workouts that take up lots of terabytes. So you can imagine that it has the potential basically to look at people's workouts all over the world, but especially within the US, and then patterns by lots of different features, maybe time of day or season or states or gender. So my collaborators and I received MapMyFitness data in 2013 and beginning of 2014 for Winston-Salem, North Carolina. And there's a paper that if you're interested in kind of hearing more about the very specifics of this type of data, I would encourage you to download from Frontiers in Public Health. And this talks about a number of the different uses that this data could have for our monitoring and evaluation of public health related questions. So briefly though, here are some of the potential functions that we can think of. This graph at the very top is the day of the year, number of routes per day of the year across 3 separate years. So you're looking at 2011, 2013, 12, and 2013. And the spikes, the small spikes that you see are the weekly patterns in physical activity. So every week, more people exercise on the weekends than throughout the week. So that's what each little spike is. But you can also see that there are seasonal patterns in some of this data. So there's the right side of that graph that is what some people call like marathon season. So it's probably the end of summer, early fall, when the weather's more ideal for exercising outside. And so as large-scale physical activity data that dates back historically to roughly 2007 and 2008, it really allows us to look at the geographic patterns of physical activity for large geographic spaces. So you could actually look at where females or males are being physically active for whole states. And also allows us to do kind of pre-post policy or intervention assessments, because we could actually look at data every hour or every day or every month. And so if you know that a policy was passed at a set point, you could actually look at the historic data that they have stored and do the pre-post for that. And similarly, because combining these two, once you have that continuous data and the geographic location of the data, you actually could look at even a single street. So if you know that there was a huge change on a single street, so a sidewalk went in, or that there's a cyclovia or something on a very specific day, you actually could see if there was more physical activity on that set street on that specific day or before and after the intervention. Here is just some images that came out of that paper in case you don't want to go grab it. This is on the left is the Winston-Salem data broken out by type of workout. You can see that a majority of the routes are runs, so that's the blue. But there are also walks or hikes and bicycle rides. And then on the right is an example of what you could potentially do if you were interested in the spatial patterns of physical activity that would then allow you to think about enhancing the built environment for different groups. So on the right, it's a map of San Francisco just on a single day. These are all the routes that were tracked on a single day. And the red ones represent women and the blue ones represent men. And you can see visually that there's a little bit of different spatial patterning in where men and women are being physically active in San Francisco on this specific day. So MapMyFitness was purchased by Under Armour at the end of 2013, early 2014. And so Under Armour is still working on a protocol for continuing to share this type of data. And I'm working with them on trying to interface with researchers in a way that they're comfortable with, that their consumers would be comfortable with, and that researchers find the data valuable. There are 2 papers out, the one that I mentioned already, that's a methods paper about using this type of data for physical activity research, and then another paper out of Washington, St. Louis that pulled routes to look at different patterns of physical activity by neighborhood socioeconomic status. There are a lot of advantages to this type of data, and I'm sure that you guys maybe can think of a lot of others beyond this, but it provides that fine-grained spatial data across a really large geographic scope, and previous work that uses GPS is smaller, usually on smaller samples and for a restricted time. So maybe we give GPS units to up to 500 people and we track them maybe for 7 or 8 days. And this alternatively has data for years, geographic data for years, and it's a lot less participant burden because this is something that it's data basically that's been pre-collected. But you can also probably think about and identify a lot of disadvantages, the biggest one being generalizability. So who decides to use this app, then which routes they decide to use it for. So you download the app, but you're not necessarily going to use it on every workout. So there are some selection factors. And then there's some differences in the GPS signals, and you're not tracking someone's GPS for their whole day. So it's kind of this discontinuous monitoring. It's also a little challenging to think about making inferences from a constantly changing database. So if you were just trying to get an average, really being specific about the time frame you want that in. Otherwise, every single minute of every single day, there are people tracking more and more physical activity on MapMyFitness. We don't, right now, have a way, they don't store any changes in the user characteristics. So as I said, you get age group, BMI, and gender. If your BMI has changed, it's unclear how that's actually stored in their database. So it's just one user characteristic. And similarly, a lot of people are using this app because it's a potential behavior altering technology. And so while it's a tracking technology, if you're using it to try to change your behavior, it might not accurately represent the population. The biggest issues, I think, though, are the last three that are listed here. The size of this data it's just incredible. It's not that much bigger than genetic data, but it's very, very unwieldy and hard to handle. I had this data at University of Michigan before I came to UNC, and it was on a cluster server. And then down here, I've been in negotiations trying to move it to another larger space, and that's just for one city. There are also ethical concerns. IRBs don't really know how to handle this type of data, and similarly, companies are really hesitant about making sure that their consumers feel safe with the data that's been entrusted to them. And so that plays into the last thing, which is that obtaining this data is a little bit challenging, and we do definitely have some more hurdles to go through before this data is something that collaborates very easily with researchers. But we're definitely making progress, and we have a new data use agreement from Under Armour, and have talked to them about their new privacy agreements and making sure that things are in line with what their priorities, both their priorities for their consumers, making sure that their data is safe, and for research. There are a number of other apps that are very similar. They include things like Strava, Runkeeper, and Endomondo. We don't know what market share all of these apps have, and we don't know what market share MapMyFitness has. That's one of the things that these companies are particularly proprietary about. But you could imagine that research that does pre-post policies and other things could also leverage these types of really big data tracking devices, quantified self, in order to get at some of these policy-based questions. So in terms of where my project stands right now, I have the Winston-Salem data set, and I've been working on that in terms of getting some methods stuff together on how to handle this data. But because the data set that I was given for Winston-Salem was given to me before Under Armour purchased the company, I am working on writing an R21 that would interface with new data in Minneapolis. And that R21 would work on kind of a validation or generalizability of this data in terms of how well physical activity patterns track between MapMyFitness data and our traditional surveys. So do places that come up as having a lot of physical activity in the behavioral risk factor surveillance system also have a lot of MapMyFitness routes, and seeing really how they compare, and whether this would actually be a tool that we could use for surveillance or pre-post. And then the other thing that would be really interesting for built environment work is that there are methods where we could come up with all of the potential routes that you could have run. So you left your house and you went on a half-a-mile run, and there are many, many half-a-mile runs you could have run, and compare the one that you chose to all of those alternate routes, and look at the characteristics between them to kind of get at the different social and built environment characteristics. And that's actually an enormous computer science task of generating those alternate routes. So that's what I'm currently working on. But I would love to also do a difference in difference approach for policy changes using the MapMyFitness data. So this allows us to have a form of data that would be comparable across the whole U.S. and for a pretty wide time range. And so we could do things like if we use the complete streets policies that have been that have been implemented. You could get pre-post those and compare the difference to places that didn't have the policies. So mostly I wanted to present to you so that you had an idea of kind of that this data exists and see if you guys had any questions or comments, but mostly if you have research ideas or you want to collaborate or think about ways that this data could be used in, as a novel tool for physical activity research, I would love to hear them.
Great. Thanks so much, Jana, for a really nice presentation, really interesting. And I have a couple questions, but let me open it up first for other people if you have any questions or comments for Jana, or research ideas or collaborators.
Hi, this is Teresa Penbrook, and I was aware of this and I use MapMyFitness, and I had actually, I think last year had contacted, I was trying to find a name on the website, trying to get a hold of somebody there to see about potentially integrating some of the data rather than accelerometer use for middle school tracking for our surveillance and management toolkit work, and was not successful in getting any kind of response. Maybe I just didn't have the right people to talk to. So I'm just wondering, do you feel like there's a better climate now where people might be willing to collaborate on this information?
Can you guys hear me?
Yep,
Hello?
we can hear.
Yep.
Mm-hmm.
Okay, perfect. Sorry. Yeah, I switched to my cell phone because I think maybe that would be better for call quality. So, okay, so it's a little bit complicated on their end. I view myself as very lucky to have stumbled basically upon the correct person at the correct time in order to get a contact with them. So they have a whole arm now of Under Armour called Connected Fitness, and Connected Fitness is integrating both MapMyFitness as well as MyFitnessPal and a bunch of the other apps that they've recently acquired. Kyler Eastman is the contact that I've always worked with MapMyFitness, and he's the one who really pushes for using this type of data for helping society. So when MapMyFitness wasn't owned by Under Armour, their CEO as well as Kyler, the two of them discussed with me that their general belief was that if a company was going to hold on to your data, that they needed to either be providing you with a service or providing a greater good to society. And so they felt that the research that I was doing and the things that I wanted to do with this research fell under that second part. That being said, there's no one whose time right now in Under Armour is devoted to interfacing with researchers, and it's not a huge priority for them, commercially, right? Mm-hmm. And so I've gone to the Under Armour headquarters now once to talk with their lawyers and also to talk to them about the importance of this. And I anticipate that this is going to be a pretty long process of showing them how important this could be. And one of the main reasons I've written the R21, besides that I'm not a computer programmer and I can't really handle these huge amounts of big data on my own, but the main other reason is that we need some way to pay to set aside some time of someone who's on the inside to actually pull the data and to help with that and to interface with researchers. And so Kyler is great, and he does this because he really feels that it's important to the world, and he feels it's important to how this data could be used to make neighborhoods better. But his time is not necessarily allocated to this. So my guess is that he probably ended up interfacing with some sort of computer system that didn't get, the email just didn't hit the right people. The other thing is that if you are designing, they're more than happy to deal with app developers. And so if you have a set study that you're interested in, the other option would be that on your end, you program an app. So it's an open source platform, which means that you could design an app, and in that app, your students, let's say you're doing like students within a school, they would sign in with their username, and that would be them, giving permission and giving the data to you. So there's a lot of different ways to go about it. And then there's also, so the second paper I had mentioned, the one out of Washington St. Louis, they also weren't able to get in touch with MapMyFitness for whatever reason. And so they pulled, there are also, when you run a route, you can designate whether it's going to be a private route or a public route. And so they use the public ones. And so you can also, if you're just pulling a certain amount, if you're pulling just a subsample from a geographic location, you can pull those straight from the website if you're good at programming. That's like a very long-winded way to say that they do care about these types of collaborations. I think that the climate is getting better, but it is always a struggle. And I have a license agreement for the Minneapolis data, but I am concerned that, if Kyler, who's the main advocate on their side, were to leave MapMyFitness or Under Armour, then really this probably would not be a priority for their company.
This is Ken Rose with CDC. I just wanted to pipe in that we've had someone here also work with Strava on more comparing ACS to what Strava is showing, and the data is more consolidated. But so I don't know, maybe there's a chance to work through that connection as well.
Yeah, absolutely. And Runkeeper has been working with, her name just skipped my mind. There's a computer science professor at NYU. I feel like Amanda knows her name. But she's recruiting, so she's doing it the other way, which is that she's recruiting from Runkeeper participants, and so they'll sign up to release their data. So it's hard because as a company, all these companies are trying to navigate this, but there's no real model to do it, and they don't. And on our side, as people in either academia or in government, we're not used to dealing with the commercial world either. And then the products that come out, the priorities and the products that come out from either side of ours aren't necessarily priorities for the other side. So, Under Armour doesn't care if they have a publication or if they have but I think that thinking very clearly about things that are mutually beneficial to both groups is really critical. There was actually I think it was a New Yorker article that uses MapMyFitness to look at physical activity data across the U.S. And one of the things that people were most upset about in the comments and stuff is well, we don't know if this is valid, and so we don't know what does this really mean. And I think that it's our role as researchers and as policymakers to really understand these new data sources and figure out what they mean and how they compare to more of our standard measures, and also see the beauty in complementing those two types of data and the differences that make them both valuable.
Mm-hmm.
But I think that on the Under Armour side, it's not entirely clear why they chose to start acquiring all of these connected fitness apps. They say that it's for smart clothing and technology that will be embedded in clothes, and that might be the case. I'm not sure, but I think that if that is the case, that seems kind of like a short-sighted use of this data, because it really could be used in a much bigger, more meaningful way to help cities and governments and people to understand human behavior, physical activity behavior.
Right. And Shannon, this is Keisha. I think your comment just reminds me of the importance of the work that we're doing in terms of translating our research and bridging the gaps, particularly with the private sector, who are oftentimes collecting these data that clearly can help advance the kinds of things we care about, and how do we communicate effectively those win-wins and build those partnerships. And somebody else mentioned, possibly having a future webinar thinking about, those sorts of issues and having a conversation about that. I had a question, and if people can think of other questions for Jana. I was wondering if you can talk about, based on your experience, sort of my sense is that these data and the users of these types of technology tend to come from a certain demographic, right? And so when I think about the kinds of individuals I work with here in Baltimore who are not familiar with these technologies, I wonder if you have a sense of how Under Armour or Strava or other types of companies are trying to outreach to have a more diverse sample of data users. So perhaps for their own purposes, but for researchers, then we would have a more representative sample when we think about the value of these types of data sources and data points.
Yeah, so we aren't clear about the use of these specific apps, and that actually is something that I didn't realize. To me, it's a very logical research question, and it's important to the field, but it's something that's very, very, very sensitive to companies, right? Because it involves their market share. Mm-hmm. So, and that's important to their stockholders and whoever else. So it's a little hard to say. I can tell you that, so in the article that I put in my presentation that you can find in Frontiers, the Winston-Salem data set does tend to be younger than the census, population for that area. They also tend to have slightly different BMIs, but not drastically. Under Armour and MapMyFitness I don't know that they even collect, but if they collect it, they definitely don't give it out, racial and ethnic information as well as socioeconomic information. So in terms of how generalizable this data is on those dimensions, it's really hard to say. I think we would have to do some sort of other studies to get at that, more like surveys that ask people whether they've used these technologies. It's not going to come from the company side. That's part of the reason that I've tried to think about projects that really focus on relative measures rather than absolute measures, and focus on utilizing the strength of the data to get at causal questions without worrying as much about those covariates that might make a big difference. So, if we're doing a difference in difference approach or a pre-post policy analysis, as long as the selection into using MapMyFitness is the same in that area before and after, then you could hope that will kind of even out in terms of that. But it doesn't necessarily get rid of that problem. Or similarly, using this where we create alternate routes and look at the path that you chose, that's something where it's looking at the counterfactual of the specific routes that you could have run, and your individual characteristics would be a modifier of that relationship. The other thing that I've done given some thought to is that in some ways, you could think of it that these are the people who are most likely to be influenced by changes that we might, by changes that we might make. These are the people who are eager to, take up new technologies, to exercise, and who are really motivated. And so it might represent the best case scenario in terms of, the type of impact changes could have on individuals. And in some ways, that's also valuable. So it's both of those things. But yeah, I think there certainly are selection factors, and figuring out what they are is going to take definitely some time and effort.
Yeah, definitely challenging with data that are proprietary and businesses are collecting them for marketing purposes. So yeah, thank you for that.
Yeah, I think it's interesting because I think that if a lot of MapMyFitness users might be like, I can't believe my data went for this research, and it's like, well, your data is also used all the time to market things to you. And I'm less comfortable with the idea that, Under Armour knows I went for a run yesterday, and they know that what temperature it was, and so now they're marketing, some sort of cool gear clothing to me.
Right.
Is more upsetting to me than using my data for research purposes. So But, after what happened with Facebook and people being very upset about the research that they were doing, partly because they were manipulating what different users saw, which is very different, I think, than pre-recorded data. But I think that created a culture where people are, hesitant to hear what their companies are doing with the data. So I just found, and maybe I will also send that around, but the article is in the Wall Street Journal, and it's called "The States Where Fitness is King," and that data also comes entirely from MapMyFitness.
Okay.
And so the thing is that it's a priority for someone in Under Armour. They think that this is really valuable, and they want to showcase how useful it can be, but the link with researchers, is still being hammered out.
Very interesting. Yeah, thanks. Please feel free to send that article to me, and we'll be sure to get it out to the network. So thank you.
Yeah, absolutely.
Can I make one really brief comment that just occurred to me as Jana was talking about this? I don't know if you guys can hear me.
Yep.
I'm not on the computer, so, I wondered, really going back to the broader sort of implications of how we collaborate with the private sector and when is that possible? And I wondered, maybe not specific to Under Armour, but a lot of companies now are trying to sort of market almost the social benefit, a little bit like some companies claim to be green, or they claim to be, having this other more humanitarian side, and whether that's part of their impact investment portfolio, or there are very savvy ways now that companies are actually trying to go beyond standard marketing to market how socially responsible they are. And it just occurred to me it's probably just a limited set of companies, but that might be a really interesting avenue to explore. Either, would that open up new types of collaborations or beta testing with different populations, or it just sort of changes the angle of the conversation, and I just thought I would mention it.
Yeah, so absolutely. I think that, my conversations that I've had with MapMyFitness and Under Armour, whenever I have the conversations and actually explain to them what I'm doing and why I think it's valuable and how I think it can help them as a company in terms of how they, what they provide to the world, they've always been very receptive. I don't think companies are necessarily, maybe this is a naive opinion, but I don't think companies are necessarily it's not necessarily all marketing. A lot of them do want their data and their products to help, but they're bogged down with, the day-to-day of making the app better for specific users and building all sorts of internal analyses to check out, different features and things that they need. And I've talked with, in terms of MapMyFitness and Under Armour, I've talked to them pretty explicitly that, we have lots of ways to accurately assess physical activity, right? We can put accelerometry on people, we can do all of these things, and the beauty of this data is not necessarily that it's another way to measure physical activity, it's that it's giving us an entirely new dimension, and it's really telling us where that physical activity is occurring and how we could, and from that information, helping us to understand how we could change communities to really make a difference in the amount of exercise that people get. So they've been very receptive to that idea, not just because they want to sell people exercise clothing, although I'm sure that's part of it, but because that's, these companies do want to ultimately, these are fitness companies, they ultimately want to, see healthy people.
Mm-hmm. Yeah, good points. Great. Is there anything else anybody has for Janet? Any other questions or comments? Okay, hearing none, I want to just thank Jana for presenting today, and we will have we'll share the article that she mentioned, and also provide your email address, Jana, if you're comfortable with that, so people can follow up with you directly if there are additional questions or comments.
Yeah, absolutely. I would love to hear anybody's ideas they have, or if there are concerns or anything really that you want to talk to me about this. I would be more than happy.
Awesome. Great. Thank you so much. That was terrific.
No problem.
All right. So again, for the rest of you on the phone, if you're interested in leading a future research in progress, we like to rotate those with a presentation from somebody from the practice-based world. So we tend to have a practitioner as well. So if you're interested in either giving the research in progress update or speaking from a practitioner perspective, please let us know. We're looking for speakers for future calls. So I wanted to just turn to the portion of our call where we do what's called open mic, and this is the opportunity for updates from the field. I have a few, but I wanted to begin by just letting Amanda make a comment since the deadline's tomorrow on the ALR conference. So Amanda, I'll let you start there, and then I will make some additional announcements, and we'll open it up to the group.
Sure. I actually have good news for everyone. We are working with Elsevier on our conference this year, so we've been talking with them. We're actually going to extend the deadline for abstracts for the Active Living Research Conference to September 4th. So if you go to the website, that update may not be made yet, but you can say that you heard it from me. So yeah, the deadline will be extended to September 4th, so that gives everyone a bit of extra time to get your abstracts in, and email us if you have any questions.
Great. I'm sure that is great news for many of us who have yet to push the submit button. So. Yeah. I'm going to do that late tonight, so thanks. Is there anything else you want to say about the conference while we're registration, or any other updates about ALR?
Not really. The registration's already open, so I don't really have anything else at this time. Just a big encouragement to have people submit abstracts.
Okay, great. Thank you, Amanda. So I have a couple things. So speaking of conferences, as Tom mentioned earlier when he provided the CDC updates, coming up very soon in October is the America Walks Summit, which is happening. So the National Walking Summit will be held in D.C., Washington, D.C. from October 28th through the 30th. I encourage you to register if you haven't already. Tom will be moderating a couple of sessions, and I know I'll be there presenting. I think I don't know who else on the phone is going to be presenting, but look forward to meeting with people. And if you're going to be at the Walking Summit, we'll send out an email, and would love to find some time to meet up with people socially. So we'll be on the lookout for that. Probably happening on that Wednesday or the Thursday of the summit. In terms of other updates, last week on October, on August 21st, we sent out an update from the network, and I just wanted to highlight a couple things that were included in there. First of all, the University of South Carolina Prevention Research Center is fielding a survey to better understand how physical activity researchers and practitioners receive, seek out, and share information about physical activity and public health. So I want to remind you that there is an anonymous online survey that's out. The link is in the email we sent last week, so please fill that out if you haven't already. That update also included a couple of job opportunities, so one at the University of South Carolina and the other with the National Complete Streets Coalition. So if you're interested in those, also look there. For this particular call, several people have said that this time doesn't work usually, and so we have put out some potential dates and times for future calls. And so there's a Survey Monkey out for that. Please complete the survey by September 1. Again, we want to find the time that works for the most individuals to be able to participate in this call. We've heard that they are useful, and people are enjoying them thus far and feel like they're learning information and hearing about things going on in the field. So we want to continue to have a good turnout. So please fill out the survey so we can identify the best time that works for individuals. Are there other comments or things that folks want to share right now? I'll pause and just open it up for an individual on the phone to share information.
Hi, Keisha. This is Pam Idsen with the National Physical Activity Society. And our members are mostly practitioners in physical activity and public health, nonprofits, and university members. But what I wanted to share is that we are working on our 2016 webinar schedule for practical webinars. Typically, they're research-based, and they have a research component to them, and also have a practical application to them. So if there's anyone who is wanting to share research with practitioners, struggling to find ways to share research with practitioners, please get in touch with me. It's Pam at physicalactivitysociety.org, and we are looking at the 2016 schedule right now.
Great. Thanks, Pam. And if you want to send me an email with some text about that, we can certainly send it out when we follow up from this call. So we can include
You've got it.
Thanks. Great. Other updates or things folks want to share before we wrap up today?
This is Tom. Just to mention that the Surgeon General will be at this walking summit. So if you want to see him, that's a good place to do that.
Great, thanks for that reminder. And I think the conference schedule and agenda are online too, so you can look and take a look at that and plan out your time accordingly. We hope to see many of you there. That comment, actually, Tom, maybe you also remember that several people are going to be at APHA in the fall in Chicago, and so we will be putting together a summary of folks here who are presenting. There are a couple of sessions already that we've highlighted that we'll share so folks are aware of what's going on at APHA from PAPRN Plus members and from PAPRN members as well.
This is Amanda. I do have one more breaking news story about ALR to share. So we've just invited our keynote speaker. I'm not sure if anyone on the call will be familiar. His name's Julian Agimon, and he is a professor of urban and environmental policy and planning at Tufts University. So he's the originator of the concept of just sustainability. So he talks a lot about social justice and sustainability. So that is another fun fact that has not been announced to the public yet.
Oh, that's great. Very cool.
We're looking forward to having him. He looks like a great speaker and has a great background.
Yeah, that's awesome. And as a Tufts alum, I am supportive of that. So thank you for that. And my final announcement for today is just a little bit of a staffing change at the coordinating center. I know many of you have received emails from Ricky Granderson. Ricky left at Hopkins to go to grad school at University of Michigan, so we will miss him. But I'm pleased that my colleague Marianne Bailey here at Hopkins is stepping up to help assist with the coordinating center. And so you'll hear from her, you'll hear from me and Amanda as you have in the past. And just always wanted to recognize Ricky's contribution and say thank you there, but also welcome Marianne to the team. If you have any questions about any of our activities, feel free to email me or email the PAPRN Plus email address, which is PAPRNplus spelled out at gmail.com. And with that, we have, I guess, 2 minutes to spare before 4. I wanted to just thank everybody for being on the call today. Again, thank you, Janet, for a really terrific presentation. Again, if you're interested in presenting your work, please reach out to us. We welcome opportunities for you to share with the field what's going on, and I hope everybody has a wonderful evening and a great weekend. So thank you very much.
Great presentation.
All right. Bye.